I'm Glenn Campbell. I call myself a demographic philosopher. I'm looking at life and trying to predict the future through the lens of demography, or the study of human populations. Today is Thursday, March 26, 2020, and we're in a time of great cultural insanity. The world is facing two simultaneous calamities: the COVID-19 epidemic and the collapse of the world economy. And in general, people and governments are handling things pretty poorly. Far and away, the biggest threat today is the global economic collapse, which is going to be much bigger than the one in 2008. This is certain to cause more human misery than any virus. But as of today, the world seems to be treating the virus in isolation, as though it was the only thing that mattered. And in this episode, I'm basically going to follow the same route. I'm going to talk about the virus and how it spreads, but I assure you the economic collapse will consume many future episodes. So the biggest insanity of the moment is the current obsession with lockdowns. This is the emotional solution to every threat. Just lock everything down. Everybody stay home. Hide under your pillows. No one in or out. A lockdown, as I define it, is when a whole country, state, or region is ordered to shut down. Transportation is restricted, and all supposedly non-essential businesses are told to close. All those workers are expected to go home, hunker down, and wait for some kind of all-clear signal from the government. It is seen as your patriotic duties to sit on your couch, watch TV, and not leave home. So to put this episode into historical perspective, as I record this, there have been roughly 800 coronavirus deaths in the USA. It is senseless to talk about the number of cases because the U.S. just doesn't have the capacity right now to test all the people who might have it. At present, some 24 states have enacted lockdown restrictions requiring non-essential businesses to close. What constitutes non-essential is a matter of debate, but it's fair to say that half the states have shut down half their businesses, and the situation is roughly similar in Europe. There are multiple absurdities in this. The biggest one is that any lockdown assures a rapid and brutal economic decline, much faster and harder than it would otherwise be. No matter how you measure human misery, the economic collapse is certain to cause far more of it over its lifetime than any virus, and over the course of years, not just months. Yet politicians don't seem to be factoring in how these lockdowns are making the economic crisis even worse. In popular rhetoric, the economy doesn't matter right now. All that matters is saving lives. If even one life is saved by these measures, it's worth it. What these speakers don't understand is that all of human well-being ultimately rests on the economy. If you deliberately nuke the economy, like a lockdown does, ultimately people are going to starve. They may survive the virus, but they'll be living in a world more horrible than you can imagine. A kind of Venezuela or North Korea world where nothing works, including medicine, because you don't have the economic underpinnings to support it. Many of the workers who are being told to go home today will never go back because their jobs will be gone. This is a sudden, brutal layoff of a major portion of the workforce instead of the gradual waves of layoffs that you usually see in a recession. Make no mistake, an economic collapse was destined to happen, with or without this virus, but lockdowns assure that it is happening much harder and faster than it had to be. Another great absurdity is that these lockdowns aren't accomplishing what they claim to. They aren't actually saving lives. Now, I understand the desire to flatten the curve, but there's a deep fallacy here. I'll get into that later, but really you don't want to flatten the curve. You want to reduce it altogether. You want to decrease the total number of cases, not flatten them out. Lockdowns are like trying to kill a mouse with a sledgehammer. Sure, you might eventually get the mouse, but you're going to cause so much collateral damage to your home that the mouse doesn't matter anymore. Now, the main focus of this episode is figuring out what works and what doesn't in the fight against the disease. Hygiene works. Changing contact behavior works. Lockdowns don't work. They're a disaster in the making. And to illustrate this, I'm going to focus on the current epidemic in two countries, Japan and Italy. You may not have heard much about the coronavirus epidemic in Japan, and for good reason. It seems to have fizzled. Even though Japan was one of the first countries outside China to receive the virus, cases have not spiked exponentially. In the current official accounting, there are about 1,200 diagnosed cases and about 45 deaths for a population of 127 million. And the numbers are rising only slowly. Compare this to Italy, with less than half the population, 60 million, which was exposed to the virus later than Japan. There they have about 7,000 deaths in Italy and at least 80,000 cases. Italy is in full lockdown mode right now, while Japan is not. In Italy, transportation has essentially stopped, non-essential businesses are closed, people are ordered to stay in their homes under threat of fines. The whole country is essentially in a wartime blackout, yet cases continue to explode. Back in Japan, it's basically business as usual. The subways and trains are still running, still packed with sardine commuters. Most businesses are still open and operating as usual. Big gatherings and entertainment events have been canceled, but clubs are still open. Sit-down restaurants are still open. I confirmed this with a friend who lives in Japan. Not much is shut down. Yet we have a feeble 45 deaths in Japan versus 7,000 in Italy. So on one side we have Italy in full lockdown mode where the epidemic is raging, and in Japan with no lockdown it seems to be petering out. So what gives? Why is there so much difference in how the virus attacks each country? If you understand this, you'll understand what really works and why lockdowns are such a grievous mistake. So you can't blame the medical system. In Japan and Italy, they are roughly equivalent. You also can't say that Italy has more coronavirus deaths because it has so many old people, because Japan has even more. So what is it that makes Japan essentially immune to coronavirus, at least for now? So here's my theory. Japan has been largely spared by the virus because it's full of Japanese. Now, I don't mean that in a racial sense. There's no evidence that the virus prefers one race over another. I mean that there's a cultural component. To put it crudely, the Japanese are obsessed with hygiene, while the Italians are not. Now, I think it's unfair and bigoted to apply such stereotypes to individuals. You shouldn't call someone a dirty Italian because on an individual basis it may not be true. But it's not unfair to acknowledge measurable statistical differences between populations. That's called culture, and it's a real thing. The Japanese, as a culture, place high value on personal hygiene, on being and appearing clean. This is the home of electronic toilet seats to thoroughly clean and sanitize your bum. Electronic toilet seats aren't doing anything to prevent the spread of COVID-19, but they reflect the mindset of the Japanese people. This was a very clean society long before the virus hit. It is also not a touchy-feely culture. There's not a lot of hugging or social kissing. In Japan, you keep your distance. Italy, on the other hand, is a very touchy-feely culture. Lots of warm embraces and kisses on the cheek. When you talk to someone in Italy, you come up close to them. I can't say that I know Italian culture very well, but it's obviously different from Japanese culture. Statistically, Italians and Japanese interact with each other differently, and these differences are going to change how COVID-19 moves through the population. So here's what I think is the single biggest difference between Italians and Japanese. It's how they greet each other. In Italy, they shake hands. Maybe they embrace. They are physically close. In Japan, they bow from a respectable distance. It is considered rude for anyone to touch anyone else in Japan without a justifiable purpose. Just eliminating handshakes could be the biggest coronavirus prevention measure short of a vaccine. No one knows yet how big a vector handshakes are, but I suspect it's huge. Have you ever wondered why so many Western politicians are getting the virus? Far more than the statistics suggest. Politicians shake a lot of hands. Shaking hands is a solid viral connection between one individual and another, and Japanese culture has almost completely eliminated that vector. Then there are all the other ways the Japanese try to be clean. I spent 2 weeks in Tokyo in 2012, and one thing that struck me is how many people were wearing surgical masks in the street. Initially, I thought this was because people were paranoid about catching something. And that may in fact be true, but there's another side of it. If you have a cold, it is considered rude to cough without a mask. It's not yourself that you're trying to protect, but others. If you coughed in public and weren't wearing a mask, people would look at you askance, which is the Japanese equivalent of yelling at you loudly. A Japanese government report on March 9th found that 80% of the Japanese who got the disease did not pass it on to others, which is the sort of R0 you can live with. According to conventional wisdom, the virus is supposed to be passed to between 2 and 3 people on average. That's the generally accepted R0. But Japan is showing only a fraction of that, and I think it's because of their culture, their way of interacting. So if this is true, that Japan has licked the virus just by being Japanese, it suggests that the best solution for other countries is simple behavior change. Americans and Europeans need to be more Japanese in their hygiene behavior. And they're doing it. They've stopped shaking hands. Coughing in public is now a no-no. There are all sorts of easy and cheap changes that can be made by individuals and businesses to emulate the Japanese model. If a society does enough of these high-value things, it pushes the R0 below 1 and the virus expires. Now, in an earlier podcast, I talked about herd immunity. That's the notion that if a certain percentage of people in a population get a virus, it helps protect the others because the virus now has no way to get to all those uninfected people. But I'm now wondering whether herd immunity is relevant at all. It's kind of a red herring distracting us from the thing that's really important, which is the R0. That's the number of people on average that each carrier of the disease infects. If the R0 is above 1, it spreads through the population. If it is less than 1, the virus eventually expires. If you can push the R0 below 1 and keep it there, then herd immunity never becomes relevant because the virus expires after only a couple of hops. One person might give it to another, who might give it to a third, but eventually it stops, not very far from where it started. The media, on the other hand, have been treating the R0 as a fixed number that is a characteristic of the virus. It's not. It is a characteristic of the human culture that carries the virus. One virus may be more inherently transmittable than another, but the actual transmission is still done by humans. So it's totally dependent on human behavior. Change the behavior and you change the R0. What the Japanese seem to have done is push the R0 close to 1 just by being Japanese. They just aren't giving the virus enough opportunities to reproduce itself, so it's dying off before it reaches the broader population. Yes, the Japanese are still riding in packed subway cars and going out to clubs, and it's probably true that some people are catching the disease in these places. But if it's not a major source of transmission, it doesn't push the R0 over 1. Yes, the R0 may have been 2 to 3 in Wuhan, China, maybe even higher, but that was Wuhan, China, an entirely different culture from Japan. Different hygiene standards, different ways of interacting. In every culture, the R0 is going to be different, but our culture-blind thinking means that we've been treating it as a fixed number. We're saying, boy, if the R0 in the USA is the same as it was in China, then we're all screwed. Well, it won't be the same as it is in China because America is a different culture with different ways of interacting. Furthermore, the R0 is highly malleable. People can be quickly trained to change their behavior, especially if they know their lives depend on it. Just by not shaking hands, an entire culture can reduce its R naught by a significant factor. I have no idea what that factor is, but I bet it's big. An important thing to note is that you don't need to eliminate every conceivable source of transmission to push the R naught below 1. You only need to target the biggest forms of transmission. If you can neutralize the things that contribute most to transmission, like handshakes and doorknobs and getting directly coughed on, then you may not have to sweat about, the minor ones, like riding on the subway or going to a club. You just need to suppress the major vectors enough to get the R naught below 1. You don't need 100% sterile containment. You just need a good enough reduction of the main sources of transmission. Lockdowns don't acknowledge this. They are intent on nothing less than full containment. Everyone is supposed to lock themselves in their homes so there's no possibility of transmission. And it works. People who are locked away from each other can't spread the virus. But you've also disabled your whole society and economy for no good reason. A lockdown is a carpet bomb attack on all forms of personal social interaction, most of which have little chance of spreading the virus. In many states, you can't even go to the beach anymore because there's a possibility, however thin, that the virus might jump from one beachgoer to another. If that's possible at all, it's probably only a 1 in a million chance compared to, say, a 1 in 10 chance of spreading the virus with a handshake. The trouble with blanket lockdowns is they have no sensitivity and no perspective. They are treating highly unlikely sources of transmission exactly the same as likely ones. In the philosophy of lockdowns, no risk of transmission is acceptable. Only total containment will do. And this just won't work. Much attention has been focused on two sources of transmission that may be possible with COVID-19, asymptomatic transmission and aerosolization. Asymptomatic transmission means that someone who shows no symptoms of the disease can still give it to others, and aerosolization means the virus can be transmitted through the air for long distances, not just within a meter or two of someone who coughs. Taken together, these two factors mean that no one can trust anyone or any place. If you walk into an airport terminal and breathe the air, the virus might get you. If you come within 6 feet of someone who shows no symptoms, you still might die. While these vectors may be real, they're probably not significant enough to change the R naught. Yet lockdowns treat them all the same. We're going to close all the airports and keep everyone at least 6 feet from each other, regardless of the circumstances, because nothing less than perfect containment will do. A sensible epidemiological approach is, let's address the main factors. The stupid approach is, let's address every conceivable factor. The first approach is manageable. The second approach is impossible and unsustainable and frankly insane. And in the process, you're absolutely killing your economy. I spoke about lockdowns in a previous podcast. I called them national suicide. Once you start down this road of seeking absolute protection at any cost, how do you call it off? Right now, you've got millions of people hunkered down in their homes waiting for the all clear from their government on when to come out. So when will this all clear be issued? 2 weeks from now? 6 months? How will conditions in 6 months be any different than they are today? The virus will still exist, but no one will have learned how to manage it in a real-world setting. Lockdowns are like curing a drug addict by throwing them into prison or into a locked rehab facility. Yes, if you deprive him of access to drugs, he will get off them. He will detox. At the end of his stay, the addict will be clean, but he hasn't learned anything about how to stay off drugs, and he'll go right back to his old behavior as soon as the drugs are available again. And that's what lockdowns are. They just cure people for the moment. They don't train them in sustainable ways to protect themselves. So what are the justifications for these current lockdowns? There are several justifications, and I think they're all pretty damn stupid. First, there's this notion of flattening the curve. If a certain number of people are destined to get the disease, then you don't want them all hitting the hospitals at once. Services are going to be overwhelmed and most people won't get treatment. It would be better, the reasoning goes, to spread those cases out over a longer period of time so more people can get treated. The main fallacy here is the assumption that there are destined to be a fixed number of cases, like 10 million requiring hospital care, and that there's no way to change this number. The experience in Japan says otherwise. You can change the number of people infected by changing human behavior. The Japanese don't have to worry about flattening the curve because their curve is already pretty manageable. Instead of flattening the curve, we should be reducing the curve so that fewer people get the disease. Lockdowns don't really help with this because they aren't training people how to reduce their exposure. Another reason lockdowns are taking off right now is that they're both popular and easy to promote. Politicians love lockdowns because it gives them an easy way to show that they're doing something. They're taking charge. Lockdowns give them a chance to project themselves as strong, decisive leaders, not waffling, nuanced bureaucrats. The populace, in turn, seems to appreciate the apparently bold leadership of these moves. They think that this one simple solution is going to solve everything. Most of the lockdowns in the USA have been in place for only a couple of days. So far, the average citizen seems to be on board, largely supportive of their leaders. But let's see how sentiments evolve as 1 week turns into 2 or 3, and all the hidden costs of imprisonment begin to sink in. Because that's what lockdowns really do. They imprison people without a trial. They force them into house arrest, which gets harder and harder the longer it goes on. I can't even begin to describe the huge toll this is going to take on people's finances, social life, and sanity. Many of the activities you used to engage in are simply not available anymore. So today is March 26, and many of the signs I've seen on businesses say reopening April 6th, and that's about 12 days from now. That's plenty of time for people to learn how horrible house arrest can be. They may also begin to see that the politicians who advocated the lockdowns don't really have a plan at all. They're just responding to public hysteria with the illusion of a plan that's in no way workable. Personally, I don't think these lockdowns could go on for very long, but by the time they end, the damage is done. Sure, people can be allowed to go back to work, but they may not have jobs to go back to. It's hard to start up the glue factory once you've shut it down. Another reason I think lockdowns are popular is that the Chinese did it. They were the first to experience the virus, and they responded in a massive totalitarian way, and it would appear on the surface that their efforts worked. For example, China has been claiming almost no new cases for the past couple of weeks. The number of confirmed cases is stuck at around 81,000, and any new cases are supposedly brought into China by foreigners. This supposed success story is cited by Western politicians as proof that lockdowns work. But is any of this real? Has China really cured its coronavirus problem, or is this just an incredibly effective propaganda effort? China has been manipulating its statistics for decades, claiming, for example, that it was achieving consistent economic growth of 6% year after year. In this totalitarian state, only the Chinese government knows what's really going on in China, and it's entirely within their power to suppress all new cases and hide all the new deaths. But even if the Chinese numbers are accurate, what has been the cost? If the lockdowns continue to this day, months after they started, they can hardly be considered a success story because the ultimate goal is to let people out so they can pursue normal life again. I'm not sure whether this is happening in China. Are the Chinese people still semi-free like they were a year ago, or is everyone living under house arrest? In any case, China is not a good role model for the West. They can do things that other countries can't and shouldn't, like trample human rights. You don't want to follow them down that path, even if it saves a few lives. Listening to the rhetoric of Western politicians, I hear two contradictory philosophies. One is that this is a war, We are fighting an external enemy, the virus, and we all have to make sacrifices for the war effort. The other thing I hear politicians say is that every life is precious. Even if this lockdown saves only one life, it will be worth it. Well, which one is it? When you're at war, you don't worry about a single life. You don't try to protect everyone from everything. In a war, commanders have to make cold, calculated decisions about who to kill. Essentially, they're going to put some soldiers at risk to protect others and to protect the country they're trying to save. They're balancing the good of one group against the good of the whole. They're making these hard triage decisions about who to save and who to let die. An irresponsible commander is going to kill a lot of his own troops. It's part of the job. But politicians and businesses can't do that. In these worlds, every life is precious and every life must be saved. No one must be submitted to any kind of definable risk. If you're a business in America and one of your customers suffers any kind of injury in your business, you're going to get sued. If you're a politician and you make any kind of decision that inflicts harm on one person, the victims and their family are going to be all over the media crying about it. In a liberal democracy, the only acceptable solution is a perfect one. Protect every citizen regardless of the costs. Unfortunately, this won't win you any wars. Winning a war requires having a strategy, and lockdowns don't involve any. Lockdowns are pure impulse. They are pure fight and flight. Right now, people are in flight mode. They're running away to their bunkers without thinking about the consequences. In a modern economy, everyone running for the bunkers at the same time is a recipe for disaster, because an economy needs people to be doing things. They need to go out and buy things. And if everyone stops buying all at once, it becomes a doom loop that just goes on and on. At this point, I think we're already well into the doom loop. There's really no escape. We're being sucked down the vortex, and I shudder to think about what's on the other side.